Good morning, students. Welcome to Good Samaritan School online class. Today, HPE Health and Nutrition class, I'll talk about first aid. Everyone knows that first aid is the first and quick or immediate assistance given to the person who is suffering from either a small minor injuries or serious illness or injury, with care provided to the person who is injured to preserve their life and to prevent the condition from worsening, because when a person is injured they are prone to get further injured. So to prevent from that, we give a first aid, and to promote a quick recovery, first aid is given. In spite of good measures and safety and the development of safety device and techniques, the number of accidents is still high in day-to-day life, as you know. And indeed, there is no definite time of such injuries. Anything can happen to anyone, anywhere and anytime. So injuries usually occur in many areas. So like in farm, or during your class, in games and sports period, or while you are walking on the road. Anything can happen. While playing, someone might get fractured, or someone might twist their ankle or dislocate their shoulder, or even while walking on the road, another may be bitten by a dog or by a snake. Anything can happen. So it can be said that every individual is trapped in one way or the other by accident. So during that time, it is very difficult for us to get the immediate medical aid to the victim on the spot of the accident, because we don't know, like anything can happen anytime. The doctor will not follow you all the time. So at that time, it is very important for you to know how to do the first aid when it happens to your friend. Before the arrival of the doctor or any medical expert, so you are the one who is going to react immediately to that accident, or to that injuries, or to that illness. Either you're doing CPR, or cleaning the wounds, or stopping the blood. You must know the basic things of the first aid. So today we will discuss a little bit how to do first aid according to the injuries. Today first aid I will cover in the areas of games and sport, in the field of games and sport, because in such a field where getting injury or injured is very common. As you know, any player can injure during training or practice or competition. In reality, even you might have experience getting injured while playing once in your sports career, or during practice. So the facilities, the high facilities for a qualified doctor are available only in like a big national team or international level competition. But usually such facilities or service of a good doctor are not available during practice or training or competition in normal level in schools. So you and me are the one who should know, or who should have enough knowledge for the first aid. So we must learn the first aid procedures to preserve or to prevent, to save the life of your friend, to prevent for further injuries, and for the quick recovery. First of all, we'll talk about the soft tissue injuries, that is abrasion. So abrasion is a skin injury when the skin rub against the rough surface. When you fall down to the ground and slide in the grass, your skin got the abrasion. So for that injuries, first of all, you have to clean that affected part with clean water, and pick up that dry tissue or the dead tissue and clean it, as well with clean cotton or cloth. Wipe off the dark part from the affected area, and you have to gently clean it so that it does not get hard or pain. Then you have to dry the affected area with a clean piece of cotton, and after that apply the medical ointment, like we used to apply betadine so that the bacteria might not take place, and use enough ointment so that it does not stick to the abrasion, and use a big piece of cotton for dressing, and then visit the doctor for proper dressing and for tetanus injection, which is required to prevent the wound and from causing any other infection, and the dressing should be changed as per the instruction of the doctor. So that is for the abrasion. Next injury is contusion. Contusion is a muscle injury, or contusion also be due to the minor accident to the skin, such as falling or bumping into something or being hit or kicked. Contusion or bruises are common, as in medical term bruises is a contusion. So here, because of the bleeding is under the skin, there are many swell and look red and black, blue and black in your skin, and stiffness and swelling are common features at the site of contusion. Sometimes in such case muscle fail to respond. In several cases muscle become completely inactive. So management, first aid, you have to do the cold compression with ice. Immediately put that ice for more than 40 minutes, and the cold compression should be performed 5 to 6 times. That is very important, 5 to 6 times daily. If there is more swelling in the area of contusion, you can eat anti-inflammatory medicines, or for further you consult the doctor immediately. That is for the contusion. Next is laceration. It is a deep cut or tear in the skin or flesh. So this is a regular cut in the skin from a sharp object, a very sharp object, or sharp edge sports equipment. So this wound is more dangerous, and usually raw mark remains even after the treatment. So for the management, first of all, you should control bleeding before anything else. Because of the cut, it may be very deep wound, so the bleeding will be continuous. So what you have to do is you have to control the bleeding. To stop the bleeding, you have to put the pressure directly in the cut area while holding it above the heart level. So if it's in your hand, you raise the hand up or the finger up. If it is cut in your finger, or if it's in your leg, you lay down and raise that leg up for 15 minutes. And if you are unable to stop bleeding, try to use a pressure point, or you can use some cloths or bandage to stop the bleeding. So once bleeding has stopped, wash that cut area with warm water with a salt, clean that area, and if that bleeding starts, do the same with the first step. So assess and see if the cut area requires stitches. If it is stitches, if it requires stitches, you take them to the doctor. If it's not, you clean the area and put the bandage. And for a simple cut, you do not require stitches, use antiseptic ointment like betadine and cover it. So if you feel pain, waist pain, you can take the painkiller by consulting the doctor. So that's all for today. HPE class. That's all. For the next class, I will continue the first aid, like sprain and strain, how to do the first aid, how to do the management of sprain and strain. We will continue in the next class. Thank you so much for joining with me. I hope you learned something. So for more further, you can ask me or you can search yourself out. Thank you so much.